I'm Patrick Giraudeau, and I'm a professor of analytical chemistry at Nantes University in France. So I'm specialized in liquid state NMR spectroscopy, more specifically for the quantitative analysis of complex mixtures, with a part of method development and a part of applications in different fields, including reaction monitoring and metabolomics. I'm originally a method development person, and then over the last decade or so I moved a little bit more towards application. So it has been very progressive. We started to develop new methods for the analysis of complex mixtures in like 2010-12. And then in the last 10 years, we've been trying to increasingly apply our methods to a variety of metabolomics research questions, including human metabolomics. So this has been very progressive. And the main research areas are, well, the developments of fast 2D NMR methods for metabolomics. This we have been working on for at least 10 years, and we have moved quite a lot towards applications in chemical food safety and metabolomics. And then more recently, we've started to develop hyperpolarized NMR methods, so much more sensitive NMR methods based on dissolution DNP, a new instrument which is developed by Bruker. And that we are now starting to move that into applications to human metabolomics with the first small clinical study that is not yet published, but quite well advanced. Why NMR? Because it's probably the most exciting technique that one can think of to analyze complex mixtures, because it has this ability to provide both structural and quantitative information in a reproducible way. So many people are using NMR and conventional proton NMR to analyze complex mixtures. And what we're trying to do is to push the technique further in order to improve the performance of NMR and its ability to access hidden information in complex mixtures. Okay, so the IVDr platform is extremely promising in terms of instrument stability. So I'm very much looking forward to implement our new methods on this platform, because this will open many application possibilities. And also what the IVDr platform offers is the possibility to perform some interlaboratory studies and comparison with other facilities equipped with the IVDr platform. That's going to be very precious in the context of clinical studies as well. It's extremely broad because we've got collaborators in many different fields of science. But if we take the example of human metabolomics, for instance, what our colleagues in biology and medicine need is, well, a combination of different things. They are very excited about the possibilities that NMR offers to perform longitudinal studies of patients, to follow them over time, which is very difficult to do with mass spec because NMR has a much better stability over time. Also, the quantitative ability of NMR is very much highlighted by our collaborators in those fields because well, this is really something they need. They need to be able to quantify the markers very accurately. And this is something that the IVDr platforms offers. And more recently, we've been asked, would be able to quantify lipoproteins in biological fluids. And that's one of the reasons that motivated the purchase of an IVDr instruments, because this requires very specific methods that we don't have at the moment. What I expect is that, well, is first to be able to collaborate with clinicians on a number of research topics, which we are currently just starting to do. So this is a first aim, but as a methodologist, my main goal is to be able to show that the methods that we developed, which can be fast 2D NMR or hyperpolarization, can bring some information in clinical studies that cannot be achieved by conventional techniques. So as a methodologist, that would be my final aim. I think that Benchtop NMR is extremely promising for metabolomics thanks to its ability to be transportable. It means that we should be able in the future to do metabolomics in places where people currently don't do NMR metabolomics, for instance, within hospitals, talking about clinical metabolomics. So I think it's extremely promising. Of course, Benchtop NMR does not have the performance of high-field NMR, so I don't see it as a replacement of high-field NMR, but as something that would come in complementarity, for instance, for the initial screening of patients. And I also believe very much that if we want to make the most out of these benchtop instruments, we need to incorporate some very strong method development on this instrument as well. I think we are very close from the scientific point of view. I think tools can be improved, methods can be improved, but I think we already have all the tools necessary for that. So it's really a question of convincing medical doctors and clinicians that NMR can be useful. I think there is a huge communication effort to do towards clinicians, for instance, to show them that that NMR and NMR metabolomics can bring them something more than what they currently have with, for instance, biological tests and so on. So I'm very much looking forward to see what's going to come out of it.